What's up? So today what I'm going to take you through is a positional isometric exercise for internal rotation of the hip. It begins from what's called as the 90-90 position. It looks like this. So from the side, I'm going to stack my legs at two perpendicular angles. So front leg, hip in line with the knee, knee in line with the heel, heel in line with the toe, and then the same thing on the back leg, hip to knee, knee to heel, heel to toe. You know, your structure in your body it might differ a little bit, and also depending on if you've got any structural issues or mechanical issues, you might need the knee a little forward or a little further behind, and that might also change day to day. But just for all intents and purposes, try to get it as close to a 90-degree angle on both legs as you can. Okay. So the movement from here is I'm going to try and get as much weight into both my sit bones as I possibly can. So I'll show you from both angles. If I'm up here like this, right, my goal is to get quite a bit of weight coming right down through the middle, and I'm encouraging both sit bones into the floor. And to do that can be quite sticky inside this hip. Okay, so a lot of you are going to end up leaning over to the side. That's fine, but with time, just start to encourage a bit of weight into this hip. This is quite a strong capsular stretch anyway, so spend a bit of time here and just get used to it. What you can do before even doing these lift-offs is just be in the position and create some tension through the legs, so contract the muscle tissues and actually create a bit of downward pressure through my legs. You'll actually notice my front knee do that. If I relax, it lifts up a bit, but if I contract, I can push it down into the floor, and then through that basing, that contraction, I can get some strength and some lift through the torso, and I'll also strengthen my tissues in this shape. So I can use that for a little bit just to get used to the shape, and maybe you spend a minute, 2 minutes here just getting used to it, so staying with the breath. Once you feel good with that, we start going into our positional lift. Okay. So making sure that we've got all of those angles, hips right down the middle, knee in line with hip, knee to heel, heel to toe. Okay. And I'm going to use my front hand to grip my foot. Right? As I grip my foot, I'm going to use that to create some traction. So I'm going to lock my shoulder back, and I'm going to draw my ribs in and squeeze my abdomen. Okay. My opposite hand is going to be on the floor for support, so I can push the floor away from you so it can keep a nice upright position. Okay. I'm going to do these from around here, which is really challenging. It's easier to lean forward a bit, and that'll give you some more leverage. So the more leverage you can generate, the easier this is going to be. Okay. So right now, I'm going to grip the foot, sit up nice and tall, squeeze my abs, and make them nice and tight. So as always, really packing that in and feeling that abdomen nice and strong, intra-abdominal pressure. From there, I'm going to create some contraction in the arm, gripping the foot, driving the leg down into the floor, just like we did as we prepped ourselves. And I'm spreading that muscular contraction to my back leg. I'm going to engage my glute to my hip, and I'm going to spread all of that contraction down the leg. As I contract, I'm going to spread, and that's going to allow me to float my foot up off the floor. Okay. I'm not looking for the maximum amount of height. Okay. The foot lift comes by virtue of me contracting the right muscles. So it's not really so much the lift that's the important part. The important part is getting the tissues responsible for the lift to happen, getting those to engage. Okay. So just bearing that in mind, the lift is a consequence of doing the right action. Okay. So squeezing the butt, squeezing the abs, gripping everything, pushing down, breathe in, breathe out, pack it in, spread that tension, spread the contraction, lift up, hold the foot there, squeezing the butt. We'll hold for about 10 seconds and then bring it down. Okay, good. If you want more from that, contract a little harder. If that's a bit easy for you, try to sit a bit more upright, and that'll take away some of the tissue range in your hip. If that's still too easy for you, you can put a block underneath your foot and then try and lift from there, and that'll give you less range. Yeah. Alternatively, you can grab that foot, lean forward a bit. I'm going to hold it here. This is my passive range. Yeah, I'm going to breathe in, breathe out. I'm going to try and lift with my hand. bring that down. Okay. One thing to look out for is using the whole pelvis to try and get it. See if you can isolate the muscle tissue right inside the hip socket and along the femur, so the thigh bone. Okay. Be very, very careful that when you try to lift the leg, you don't roll the whole pelvis like that, right? You just trying as best you can just to use the thigh. Okay. If that's too tough, like I said before, you can lean forward. That'll give you some more leverage. Okay. And if you're one of these guys where it's really tight in this hip and you need to lean over to your side, I suggest angling your body just off of the knee line. So my bony hip bone here, ASIS, right? Bring it across my knee line there. Right? And now I've still got a straight line towards my thigh. I'm going to pull out of that, and I'll use that in this grip on the knee to give me that lift. Okay, so I can use that as a support or as a regressed version until I can get more upright in this 1990 position. Peace.